The issue of relieving administrative burden is probably no more of a pipe dream than the medical home is. I think the thing that's important is that people come up with ideas to try and figure out how to deal with the administrative burden in a way that is as efficient as possible and doesn't lead the healthcare provider to burn out. Because in most situations, healthcare providers didn't become healthcare providers to do paperwork and to sit at a keyboard. They wanted to give care to patients. And I think it's up to us to figure out how to challenge ourselves to come up with some really novel and creative ideas. And somebody came up to me and said, there's something we do in our practice to deal with that issue. And I said, what is it? And they said, we have sort of a TSA pre-check. We've created an identified group of patients who do everything by the book, who have been adherent for a certain period of time, and who we know are going to be a very low-risk category. And then what we do in our practice is we streamline them. And that is a really great idea. So I think it's up to us to challenge ourselves, to think about how we could do those kinds of things that we see happen in other situations where people have figured out, how do I decrease the line at the airport? How do I simplify certain processes that we do? In the face of insurers not being willing to do it, and healthcare systems not being willing to do it, it could be very challenging. But I think there are things that we could do at the Main Street clinical level that could be sort of like that TSA pre-check kind of model. And at the end of the day, it'll make our lives easier too.